What is hantavirus? Hantavirus is a virus that is found in the urine, saliva, or droppings of infected deer mice and some other wild rodents, cotton rats, rice rats in the southeastern United States, and the white-footed mouse and the red-backed vole. It causes a rare but serious lung disease called Hantavirus pulmonary syndrome (HPS). The virus does not remain active for long once outside of its host, less than 1 week outdoors and a few hours when exposed to direct sunlight. Please don't forget to comment, like, share and subscribe. Thank you. How common is hantavirus? Hantavirus was first identified in Canada in 1994. When researchers reviewed other earlier cases, they were able to positively identify that there were at least 3 other cases occurring before 1994, the first happening in 1989. Since 1989, there have been 109 confirmed hantavirus cases. How can hantavirus enter my body? People can contract the hantavirus infection through inhalation of respirable droplets of saliva or urine, or through the dust of feces from infected wild rodents, especially the deer mouse. Transmission can also occur when contaminated material gets into broken skin, or possibly ingested in contaminated food or water. Person-to-person transmission in North America has not been reported. A few situations of hantavirus pulmonary syndrome in South America suggests person-to-person transmission is possible. How does hantavirus affect my health? The disease caused by hantavirus is called Hantavirus pulmonary syndrome. Symptoms appear within 1 to 5 weeks after exposure. The average is 2 to 4 weeks. This disease is extremely serious since about 40% of the people who get the disease die. The disease begins as a flu-like illness. In the early stage, a worker may experience fever, chills, muscle aches, headaches, nausea, vomiting, and shortness of breath, rapid heartbeat and gastrointestinal problems. However, the disease progresses rapidly and infected people experience an abnormal fall in blood pressure and their lungs will fill with fluid. Severe respiratory failure, resulting in death, can occur within a few days of the early stage symptoms. What is the treatment for hantavirus pulmonary syndrome? There is no specific vaccine, treatment or cure for hantavirus infection, but early recognition and medical care in an intensive care unit can help with recovery. Infected people may be given medication for fever and pain and oxygen therapy. What occupations are at risk? Cases of hantavirus infection contracted in Canada and the United States have been associated with these activities. Sweeping out a barn and other ranch buildings. Trapping and studying mice. Using compressed air and dry sweeping to clean up wood waste in a sawmill. Handling grain contaminated with mouse droppings and urine. Entering a barn infested with mice. Planting or harvesting field crops. Occupying previously vacant dwellings. Disturbing rodent-infested areas while hiking or camping. Living in dwellings with a sizable indoor rodent population. For workers that might be exposed to rodents as part of their normal job duties, employers are required to comply with relevant occupational health and safety regulations in their jurisdiction. Typically, employers are required to develop and implement an exposure control plan to eliminate or reduce the risk and hazard of hantavirus in their workplace. How can we prevent exposure to hantavirus? Attempt to reduce the presence of mice and limit contact with their droppings, urine and saliva by storing food, including pet food, water and garbage, in heavy plastic or metal containers with tight-fitting lids. Sealing any holes in structures where mice may enter. Cutting back thick brush and keep grass short. Keep wood piles away from the building. Using rubber or plastic gloves when cleaning up signs of rodents, handling dead rodents, or other materials. When finished, clean gloves with soapy water before taking them off. Wash hands with soapy water, again, after removing the gloves. Setting traps when necessary. Put rodents in a plastic bag, seal the bag, and dispose.